Hi guys, Angela here back, the nurse practitioner from Revitalize. Today we're going to be talking about progesterone. So progesterone is our female sex hormone. Progesterone is produced from the ovaries. So in a normal menstruating woman, after ovulation, so around day 14, progesterone starts to rise. Progesterone essentially signals our endometrial lining to say, hey, you don't need to grow anymore. It gets ready for an egg. If the egg is fertilized, so if the woman becomes pregnant, then progesterone continues to rise. So progesterone is essential for pregnancy. Progesterone is what helps to maintain our pregnancy. Now, if the woman does not become pregnant, then progesterone does this little arc from day 14 to day 28. Again, in a normal menstruating woman, it'll go up and then it kind of comes down and it goes nearly to zero when we enter our follicular phase or when we start our period. Now, this is again, the ideal scenario, but this doesn't happen for everybody. There's lots of things that can alter this cycle. So if you don't ovulate, your body isn't signaled to have the progesterone rise. So this can happen in women that have something called polycystic ovarian syndrome or PCOS. This can just happen if you have any kind of hormone imbalance. Some women that are overweight or obese don't ovulate regularly. Some women that exercise too much or not enough. This can all affect our ovulation. Our stress levels can affect it. So if you are a normal ovulating menstruating woman, I should say, you might notice that your cycle isn't always that perfect 28 days. Sometimes it can fluctuate, and you might notice that it changes based off your stress or your travel or what you have going on in your life. And that all happens based off whether or not you ovulate, if you ovulate later or if you ovulate earlier. That is kind of our driving factor from our progesterone. Now, the problem if you don't ovulate at all is you don't have that buffer of progesterone. So some of the physical problems of that, like I alluded to before, is that growing endometrial lining, right? When that continues to grow, those cells kind of proliferate a little bit too quickly, and that can lead to things called like endometrial cancer. Now, progesterone, we have that as a buffer. It helps to thin out the lining, which is what signals our body to have a period, to release the lining every month. Now, this same concept can be applied to our menopausal women. So when our menopausal women stop ovulating or our ovaries kind of are turning on and off in perimenopausal, again, you're going to have low progesterone. So eventually, we don't ovulate anymore and we don't have any more eggs. We don't have any more estrogen or progesterone that's really being released. So that's why it's so important when we give you bioidentical estrogen here at Revitalize with our hormone replacement, we always give you progesterone. If you have a uterus, it's important that we protect your uterus, we protect your endometrial lining. So those are kind of some of the physical components of progesterone in our body and what it does. But there's a lot of symptoms that are associated with that drop in progesterone, whether that be when you start your period or if you ovulate and you don't have a progesterone rise. There's lots of different defects that can happen. Or if you are menopausal woman and you have that drop in progesterone, lots of symptoms. So progesterone is our happy hormone. So when we don't have our happy hormone, it's much harder to handle stress. We're more irritable. We have anxiety that really stems from somewhere we're not really sure. If you've ever had anxiety and you think to yourself, where is this coming from? It may be related to your hormones. You may be low on progesterone. This imbalance can manifest as some of those irritability, anxious symptoms. It also can disrupt our sleep. So progesterone, it stimulates GABA in our brain, which produces that anxiolytic effect, helping you to get sleepy and go to sleep. So a lot of the women that we give progesterone to, this helps to treat insomnia that occurs in all women, but in a lot of our menopausal women. So one example that I like to use for my patients during our visits to really give you an idea of the role progesterone plays. So most of us are familiar with postpartum depression, postpartum anxiety. This really stems from, like I alluded to before, when you're pregnant, your progesterone is very high. This is what sustains our pregnancy, or one of things that sustains it. So when we deliver our baby, that progesterone often drops off from very high level to very low. Not in all women, some it's more gradual, but in the women that experience postpartum depression and anxiety, this is often because of that progesterone. Goes from very high highs to very low lows. And that kind of paints the picture of, okay, we don't have any progesterone, and all of a sudden we have this deep depression or deep anxiety or an inability to deal with stressors. So that is why we utilize bioidentical progesterone in those women instead of giving an antidepressant, which doesn't treat the root cause, right? Progesterone is going to treat the root cause, treat the deficiency, whether that be short-term, if it's low progesterone at the end of your pregnancy, or if you're someone that has PCOS or some type of a disorder where you don't make enough progesterone. That's where the beautiful bioidentical progesterone comes in. Women really love their progesterone because it just helps them to handle their stressors. It helps them to sleep. Women that have had multiple miscarriages and finally discover it's because they had low progesterone. It's a wonderful tool. Some symptoms that might cue you into the fact that you have low progesterone. If you have really severe premenstrual syndrome, really severe PMS, you have acne, you have bloating, some of these things can be an alteration of hormones. But a lot of times, if you don't have the progesterone you need to get you through the cycle, that can manifest as the PMS. And a couple more things on progesterone. So progesterone is also it's very protective of things like our breasts. We have receptor sites in our breasts. We've already talked about the receptor sites in our endometrial or in our uterus. When we lose our progesterone, whether that be to anovulation, no longer ovulating in menopause, or some hormone imbalance, then we are at a higher susceptibility for things like breast cancer, endometrial cancer, uterine cancer. Progesterone even affects our blood vessels. We have receptor sites in our blood vessels that help to relax muscle. So it's a really powerful hormone that, yes, we do produce naturally, but sometimes due to autoimmune disorders or again, our environment, sometimes this is disrupted. So highly encourage you to get your progesterone levels checked. It's very important. When you get them checked, is going to show something different on your labs because, again, it's going to fluctuate. Here at Vitalize, we typically check your progesterone before you have a period so we can get a better idea of what's going on in your body. And that essentially sums up progesterone. Next week, we'll be hearing again from Taylor Lofton, our nurse practitioner. She'll be going over the hormone vitamin D3.